Hi, good afternoon, YB. Good afternoon, Doctor. I have three questions. I'm Daniel from Kini TV. First one is that it's been 2 months since there were cases of underdose vaccinations reported. We'd like to know there was an investigation that was into this. What is the result of the investigation, and why are there still seemingly reported, people reporting these cases? And second is related to loopholes in the MyVast system that recently Kini TV we did report on this. Are there any loopholes or are these incidents related to any loopholes in the MyVast system that led to the sales of vaccination appointments? And is the government looking into restricting access to the MyVast system to help to curb this? And the last question is we also received some complaints that people were asked to look away when vaccinations took place. We just want to know if any such instruction came from KKM or MOSTI. Thank you very much.
Well, there's been no instruction for people to look away. Maybe those people who are scared were suggested not to look at the vaccination, but they're certainly free to look at the vaccination to make sure that it goes in, to make sure there's no, there's nothing untoward that's taking place. On the issue of the loophole, we've identified that much of it centered around the add vaccinee feature in the MyVast system at the PPVs. So now we are going to introduce a two-factor authentication for people who want to add vaccinees manually. So there will be a timestamp and a personal ID associated with anybody who adds a vaccinee manually. So if there are instances of syndicates or cartel at PPVs, we will be able to quickly identify. Police reports have been made, and I think there's one case which has been referred to the DPP's office for further action. On the dosing, we've identified that initial case, there was a mistake and disciplinary action was taken against the dispenser of the vaccine. But now we have very clear guidelines that at PPVs, they are required to show you the syringe first before they administer the vaccine. And I think that's resulted in very, very minimal cases of error in terms of the vaccine doses.